shoulders drop away from your ears. Feel the tension melting from your face. Today we're going to explore something that touches every aspect of our skin health, something we all experience but often underestimate in its impact on our complexion: stress. Before we dive in, let's take another moment together. Breathe in for 4 counts, hold for 4, and release for 6. Feel your body settling into this moment. There's no rush. Everything you need to know will unfold naturally. Stress and skin are connected in ways that might surprise you. When you experience stress, whether it's a looming deadline, a difficult conversation, or ongoing worry about something in your life, your body responds with a cascade of chemical reactions. Your adrenal glands release cortisol, often called the stress hormone. While cortisol serves important functions in short bursts, chronic elevation affects your skin in multiple ways. First, elevated cortisol increases oil production in your skin. Your sebaceous glands respond to stress hormones by producing more sebum. This is why many people notice breakouts appearing during particularly stressful periods. It's not your imagination, and it's not a coincidence. Your skin is literally responding to what's happening in your mind and body. Stress also compromises your skin barrier. That protective outer layer we've talked about in other sessions, the one that keeps moisture in and irritants out, becomes more permeable under chronic stress. Water escapes more easily, irritants penetrate more readily, your skin becomes more reactive, more sensitive, more prone to conditions like eczema flares or rosacea episodes. The inflammatory response in your body intensifies during stressful periods. Inflammation is your immune system's way of protecting you, but chronic inflammation damages skin cells, breaks down collagen, and accelerates visible aging. Those stress lines we joke about? They're partially created by this ongoing inflammatory process affecting the structures that keep skin firm and resilient. Stress disrupts your sleep patterns, and poor sleep affects skin profoundly. During deep sleep, your body repairs damage, produces new skin cells, and balances hormones. When stress keeps you awake or makes your sleep shallow and restless, your skin misses these crucial repair windows. Dark circles appear. Fine lines seem more pronounced. Your complexion looks dull and tired because, quite simply, your skin is tired. Your stress response also affects blood flow. During acute stress, blood moves away from your skin toward your muscles and vital organs, part of the ancient fight-or-flight response. With chronic stress, your skin receives less oxygen and nutrients from reduced circulation. This contributes to that flat, lifeless appearance. Stress-affected skin often displays. Stress changes your behavior in ways that impact skin. You might touch your face more, picking at perceived imperfections, or simply fidgeting. You might skip your skincare routine when overwhelmed, or conversely overtreat your skin trying to fix stress-related breakouts quickly. You might reach for sugar or processed foods for comfort, affecting your skin from the inside out. The relationship runs both ways. Skin concerns themselves create stress, forming a difficult cycle. A breakout causes anxiety, which increases cortisol, which worsens the breakout. Understanding this connection helps us approach both stress and skin with more compassion and strategic intervention. Managing stress for skin health doesn't mean eliminating all stress from your life. Some stress is inevitable, even occasionally useful. Instead, Focus on building resilience and developing practices that help your body process stress more effectively. Start with breathing. It sounds simple, perhaps too simple, but proper breathing directly counteracts your stress response. When you breathe slowly and deeply, activating your diaphragm, you signal your nervous system that you're safe. Your heart rate slows, cortisol levels drop, inflammation decreases. Try this throughout your day, especially before and during stressful situations. 5 deep breaths can shift your entire physiology. Movement helps process stress hormones. You don't need intense exercise, though that can help. Simply walking, gentle stretching, or dancing to music you love helps your body metabolize stress chemicals. Movement also improves circulation to your skin, bringing fresh oxygen and nutrients while carrying away cellular waste. Sleep protection becomes crucial. Establish boundaries around your rest time. Create a wind-down routine that signals to your body that sleep is approaching. Keep your bedroom cool and dark. Put your phone away an hour before bed. These aren't luxuries during stressful times, they're necessities. Your skin repairs while you sleep, and protecting that repair time protects your complexion. Consider your stimulant intake. Coffee and energy drinks feel helpful when you're stressed and tired, but they keep cortisol elevated and can interfere with sleep quality. If you're experiencing stress-related skin issues, try reducing caffeine, especially after early afternoon. Notice whether your skin responds positively. Nutrition supports stress resilience. Foods rich in omega-3 fatty acids like salmon, walnuts, and flax seeds help modulate inflammation. Colorful vegetables provide antioxidants that counter oxidative stress. Magnesium-rich foods like dark leafy greens, nuts, and whole grains support your stress response system. You're not just feeding your body, you're providing raw materials for managing stress at a cellular level. Mindfulness practices help break the stress skin cycle. When you notice stress arising, pause. Name what you're feeling. Acknowledge it without judgment. This simple act of awareness often reduces stress intensity. Regular meditation, even just 5 or 10 minutes daily, changes how your brain processes stress over time. Your skin benefits from these neurological shifts. Social connection matters. Isolation intensifies stress responses, while genuine connection with others, even brief interactions, helps regulate your nervous system. Reach out to friends. Have real conversations. Share what you're experiencing. This isn't weakness, it's biological wisdom. We're meant to co-regulate with other humans. For your skincare routine during stressful times, keep it simple and consistent. Stress is not the moment to try new products or aggressive treatments. Stick with gentle, proven basics. Cleanse thoroughly but kindly. Use a simple, effective moisturizer. Don't skip sunscreen even when you feel overwhelmed. These small acts of self-care send powerful messages to your nervous system. Consider adding calming ingredients to your routine. Centella asiatica, also called CK, has adaptogenic properties that help skin cope with stress. Niacinamide supports barrier function and can help with stress-related oil production. Oat extract soothes reactive skin. Green tea provides antioxidants that counter stress-related inflammation. These aren't magic solutions, but they're supportive allies during difficult periods. Pay attention to how you touch your face. Stress often increases unconscious face touching and picking. When you notice this happening, gently redirect the impulse. Keep your hands busy with a stress ball or fidget toy. If you struggle with skin picking, Consider working with a therapist who specializes in body-focused repetitive behaviors. This is a real issue that responds to treatment. Set realistic expectations during high-stress periods. Your skin might not look its absolute best, and that's okay. You're managing something difficult. Perfect skin isn't the goal right now. Adequate self-care and compassion are the goals. Your skin will recover as your stress resolves. Sometimes stress reveals underlying skin conditions that need professional attention. If you notice persistent changes, new rashes, or concerning symptoms, see a dermatologist. Stress can trigger conditions like eczema, psoriasis, or seborrheic dermatitis. These respond better to treatment than to hoping they'll resolve on their own. Think long-term. Chronic stress affects more than your skin, impacting your entire health. If you're experiencing ongoing stress without relief, this isn't something to power through alone. Talk to your doctor. Consider therapy. Explore stress management resources. Taking care of your mental health is taking care of your skin health. They're inseparable. Create tiny moments of peace throughout your day. Put your hands under warm water and really feel the sensation. Look at something beautiful. Listen to a song that moves you. Pet an animal. These micro moments of presence and pleasure help regulate your stress response. They're not indulgent, they're protective. Remember that stress affects everyone's skin differently. Some people get breakouts. Others experience dryness or sensitivity. Some see accelerated aging signs. There's no single stress skin presentation. Pay attention to your unique patterns. This awareness helps you recognize when stress is affecting your skin and respond appropriately. Your skin is telling you something when it reacts to stress. It's not betraying you or being difficult. It's communicating that your whole system needs support. Listen to that message with kindness. What does your body need right now? Rest, movement, connection, nourishment, better boundaries? Your skin's appearance is valuable feedback, not a problem to fix in isolation. As we close our time together, let's take 3 more deep breaths. Breathe in calm. Breathe out tension. Breathe in compassion. Breathe out judgment. Breathe in trust. Breathe out worry. Your skin is resilient. Your body wants to heal. When you support your stress response through gentle, consistent practices, your skin responds. This isn't about perfection. It's about sustainable care that honors the real connection between your inner experience and your outer appearance. Be patient with yourself. Managing stress is a lifelong practice, not a problem you solve once and forget. Your skin will fluctuate with life's ups and downs, and that's part of being beautifully, normally human. Take good care of yourself with all the gentleness you deserve. 𝒆𝒓𝒕, the truth about skin, detoxing. Soft, calming tone throughout, approximately 1,700 words. Hello and welcome. Take a moment to settle into this peaceful space. Breathe deeply and let go of any tension you're holding. Today we're going to talk about a popular concept in skincare, detoxing. More specifically, we're going to gently explore what's true and what's not when it comes to detoxing your skin. The word detox is everywhere in skincare marketing. Charcoal masks that promise to pull toxins from your pores. Clay treatments that claim to detoxify your skin. Juice cleanses supposedly for clearer skin. The language is compelling and the promise is seductive. Purify your skin. Eliminate toxins. Emerge fresh and clean. But here's something important to understand. Your skin doesn't need detoxing in the way these products suggest, because your body already has sophisticated, highly effective systems for eliminating toxins. Your liver and kidneys are your body's detoxification organs. They're remarkably efficient at identifying, processing, and removing waste products and potentially harmful substances from your body. Your skin does play a role in elimination. Through sweat, you do release some waste products. But this isn't something that needs to be enhanced or accelerated through special treatments. Your body knows how to do this naturally. So when products claim to detox your skin, what are they actually doing? Let's explore this gently, without judgment toward anyone who's been drawn to these marketing claims. They're persuasive, and the desire to purify and refresh your skin is completely understandable. Most detox skincare products work through one of a few mechanisms. Let's discuss each one. First, many detox products are simply deep cleansing treatments. They contain ingredients like clay or charcoal that absorb excess oil from the skin's surface. This can make your skin feel fresher and look clearer, especially if you have oily skin or congested pores. There's nothing wrong with this. Deep cleansing can be beneficial, but it's not removing toxins from your body. It's removing excess sebum and surface debris. That's still helpful, just not magical. Bentonite clay, kaolin clay, and activated charcoal are common detoxifying ingredients. These materials have a negative electrical charge that attracts positively charged particles, oils, dirt, some bacteria. When you apply them to your skin and then rinse them off, you remove these surface elements along with the mask. Your skin might feel cleaner and look temporarily brighter. But again, this is surface cleansing, not internal detoxification. Second, some detox products work through physical or chemical exfoliation. They remove dead skin cells from the surface, revealing the fresher skin underneath. This can make your complexion look more radiant and feel smoother. Exfoliation is a legitimate skincare practice, but calling it detoxing is misleading. You're not eliminating toxins, you're removing dead cells that your skin was going to shed anyway. Third, some detox routines involve dietary changes, eliminating certain foods, drinking specific juices, taking supplements. The claim is that these internal changes will manifest as clearer, healthier skin. Here's the nuanced truth. Yes, what you eat affects your skin. A diet high in antioxidants, healthy fats, and essential nutrients supports skin health. A diet high in processed foods, sugar, and unhealthy fats might contribute to inflammation and skin issues. Staying well hydrated is important for skin function, but the idea that a 3-day juice cleanse will purge toxins and give you glowing skin, that's not how your body works. If you feel better or your skin looks better after changing your diet, it's likely because you're now providing your body with better nutrition, reducing inflammation, staying hydrated, or eliminating a specific food that was problematic for you. It's not because you've expelled accumulated toxins. Your liver is constantly processing what you consume and eliminating waste products. It doesn't need a special cleanse to do its job. If your liver isn't functioning properly, you need medical attention, not a juice cleanse. Now let's talk about what might actually be helpful if you're drawn to the concept of detoxing, because your skin feels congested, dull, or problematic. First, evaluate your current skincare routine. Are you using products that are too heavy for your skin type? Are you cleansing effectively but gently? Are you over-exfoliating? Sometimes skin that feels toxic or congested is actually just experiencing product buildup or barrier damage from harsh treatments. Consider simplifying your routine for a while. Use a gentle cleanser, morning and night. Use a simple, appropriate moisturizer. Protect your skin from the sun. Give your skin a break from active ingredients, from heavy makeup, from lots of layered products. Let your skin simply be, without constantly doing things to it. This less is more approach often helps skin recalibrate better than any detox mask ever could. If you're drawn to clay masks or charcoal treatments because they make your skin feel fresh, that's perfectly fine. Use them if you enjoy them. They can help absorb excess oil and temporarily tighten pores. Just understand that's what they're doing, not detoxifying your body. Use these treatments at most once or twice a week. More often than that, especially with clay masks that can be quite drying, risks disrupting your skin barrier. Remember, even benign treatments can be harmful when overdone. If you want to support your skin's health from the inside, focus on sustainable, evidence-based practices. Drink adequate water, not to flush toxins, but because your body needs water for countless cellular functions, including maintaining skin hydration and elasticity. Eat a balanced diet rich in fruits, vegetables, whole grains, healthy fats, and lean proteins. These provide the vitamins, minerals, antioxidants, and essential fatty acids your skin needs to function optimally. Get sufficient sleep. During sleep, your skin repairs damage, produces collagen, and regenerates. Chronic sleep deprivation impairs these processes. No detox mask can compensate for inadequate sleep. Manage stress. Chronic stress impacts skin health through multiple pathways: hormonal changes, inflammation, barrier dysfunction. Finding healthy ways to manage stress supports both your mental health and your skin. Avoid smoking and limit alcohol consumption. Smoking significantly damages skin, accelerating aging and impairing healing. Excessive alcohol dehydrates your body and can trigger inflammation. These lifestyle factors impact skin far more than whether you use a charcoal mask. Exercise regularly. Movement improves circulation, delivering oxygen and nutrients to your skin cells and helping carry away waste products. The slight increase in body temperature during exercise also opens pores slightly, allowing them to expel some of the debris inside. But this is a natural process your body is doing anyway. You don't need special treatments to enhance it. If your skin genuinely feels congested or problematic and simple skincare adjustments aren't helping, consider consulting a dermatologist. Sometimes persistent congestion is Welcome to this soothing moment of care. Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, use an extremely gentle, creamy cleanser, or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing; niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity; ceramides, cholesterol, and fatty acids to rebuild your barrier's structure; colloidal oatmeal, which soothes and reduces irritation; allantoin, which is calming and healing; and 𝒌𝒊𝒈 and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities. Meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin with supreme gentleness. Thank you for this time together. Calm your irritated skin gently and patiently. Welcome to this gentle space of healing. Breathe slowly and deeply, finding peace within. Today we're talking about how to treat whiteheads safely, those small closed bumps that appear on your skin and sometimes feel frustrating to deal with. Whiteheads, also called closed comedones, are pores that have become clogged with oil and dead skin cells, with a thin layer of skin covering the opening. Unlike blackheads, which are open to air, whiteheads are closed, creating that characteristic white or flesh-colored bump. The safe approach to whiteheads emphasizes prevention and gentle treatment rather than aggressive extraction. Squeezing or picking at whiteheads can cause infection, inflammation, scarring, and spread bacteria to surrounding pores, creating more breakouts. Let's explore how to treat them effectively and safely. Understanding why whiteheads form helps you prevent them. Excess oil production, dead skin cell buildup, pore clogging products, hormonal fluctuations, and inadequate cleansing all contribute. Addressing these factors prevents new whiteheads while you treat existing ones. The foundation of whitehead treatment is proper cleansing. Use a gentle cleanser once daily in the evening to remove oil, dead skin cells, and debris. For whitehead-prone skin, a cleanser with salicylic acid can be beneficial. It penetrates into pores to help dissolve clogs from within. Double cleansing in the evening ensures thorough removal of everything that could clog pores. Start with an oil-based cleanser or cleansing balm to dissolve oil-based impurities. Then follow with your regular water-based cleanser. Massage your cleanser thoroughly but gently, spending extra time on whitehead-prone areas. Don't scrub harshly. Gentle, patient cleansing works better. Chemical exfoliation is key for treating whiteheads. Salicylic acid is particularly effective because it's oil-soluble and can penetrate into pores. Use a leave-on treatment with 0.52% salicylic acid 3 to 4 times weekly after cleansing. Apply to dry skin, wait a few minutes for absorption, then follow with moisturizer. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell buildup. Use 5 to 8% concentration 2 to 3 times weekly. Some people use salicylic acid and AHAs on alternating nights. Retinoids increase cell turnover, preventing dead cells from clogging pores. Over-the-counter adapalene or prescription tretinoin used 3 to 4 times weekly can significantly reduce whiteheads over time. Start slowly and be patient. Retinoids take several months to show full effects. Clay masks once or twice weekly help absorb excess oil and draw impurities from pores. Apply to whitehead-prone areas, leave for 10 to 15 minutes, rinse with lukewarm water, and follow with moisturizer. Always moisturize after treatment products. Even whitehead-prone skin needs hydration. Use a lightweight, non-comedogenic moisturizer that provides hydration without clogging pores. Don't skip sun protection. Many whitehead treatments make skin more sun-sensitive, and UV protection is essential. Choose a non-comedogenic sunscreen that won't contribute to clogged pores. For individual stubborn whiteheads, spot treatments can help. Benzoyl peroxide at 2.5% kills bacteria and helps resolve whiteheads. Apply as a spot treatment before moisturizer. Hydrocolloid patches designed for whiteheads can be applied overnight. These protect the whitehead from touching, absorb any drainage if the whitehead opens, and create a healing environment. If you absolutely must extract a whitehead, and this should be rare, do so only if it has come to a clear head and seems ready to release. Cleanse your hands thoroughly. Wrap your fingers in clean tissue. Apply very gentle, even pressure on either side of the whitehead. If it doesn't release immediately with gentle pressure, stop. Forcing it causes damage. If it does release, immediately apply a spot treatment and don't touch the area again. Better yet, consider professional extraction by a licensed esthetician who has proper tools and training. Professional facials with extraction can safely clear whiteheads without the risks of home extraction. Never use comedone extractors or other tools at home without training. These can easily cause scarring if used incorrectly. Don't pick, squeeze, or pop whiteheads that aren't ready. This spreads bacteria, causes inflammation, damages skin, and often makes the whitehead worse. Keep your hands away from your face. Don't use harsh physical scrubs, hoping to scrub away whiteheads. The particles are too large to enter pores, and harsh scrubbing irritates skin without helping whiteheads. Don't over-exfoliate thinking more will work faster. Excessive exfoliation damages your barrier and can actually worsen whitehead formation. Moderate, consistent exfoliation works better than aggressive treatment. Prevention strategies reduce new whitehead formation. Choose non-comedogenic products, skincare, sunscreen, and makeup. Heavy, pore-clogging ingredients contribute to whiteheads. Remove makeup and sunscreen thoroughly every evening. Sleeping in makeup is a recipe for clogged pores. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Don't touch your face unnecessarily throughout the day. Your hands transfer oil and bacteria that can clog pores. Manage oil production through lifestyle factors. Stress increases oil production, so practice stress reduction techniques. Adequate sleep supports skin's natural regulatory processes. Balanced diet and hydration support overall skin health. Some people find that dairy or high glycemic foods worsen their whiteheads. If you suspect a dietary connection, try eliminating these foods for a month and observe results. Be patient with treatment. Whiteheads don't disappear overnight. With consistent proper care, you should see improvement over 6 to 8 weeks. Existing whiteheads gradually resolve and fewer new ones form. Track your progress. Take photos monthly to see improvements that might not be obvious day to day. Adjust your approach if needed. If after 8 to 12 weeks of consistent care you're not seeing improvement, you may need to adjust products, add a treatment, or consult a dermatologist. When to seek professional help? If whiteheads are severe or persistent despite proper home care, if they're causing scarring, or if they're significantly affecting your confidence or quality of life, consult a dermatologist. Prescription treatments, stronger retinoids, specific antibiotics, or other medications may be necessary. For very stubborn or large whiteheads, a dermatologist can provide in-office extraction or cortisone injections that resolve them quickly and safely. Remember that some people are simply more prone to whiteheads due to genetics, skin type, or hormonal factors. This doesn't mean you're doing something wrong. It means your skin needs consistent preventive care and patience. As we close, embrace safe whitehead treatment. Gentle chemical exfoliation, proper cleansing, appropriate products, and hands-off approach. With consistency and patience, your whiteheads will improve. May your whiteheads resolve safely and completely. May you resist the urge to pick. May your skin clear with gentle, patient care. Thank you for this time together. Treat your whiteheads safely and gently. Welcome and breathe deeply. Today we discussed preventing acne by keeping habits clean. Simple hygiene practices that significantly reduce breakouts through consistency and awareness. Clean habits are fundamental to acne prevention. While acne has multiple causes, hormones, genetics, stress, poor hygiene can worsen it, and excellent hygiene can help prevent it. These habits are simple, cost nothing, and make a real difference. Let's explore each clean habit that supports clear skin. First, face touching. Your hands touch countless surfaces throughout the day: doorknobs, keyboards, phones, money, accumulating oil, bacteria, and dirt. Every time you touch your face, you transfer these to your skin where they can clog pores and cause breakouts. Become conscious of how often you touch your face. Most people do it unconsciously dozens of times per day, resting your chin on your hand, rubbing your eyes, picking at blemishes. Set an intention to keep your hands away from your face unless you're cleansing or applying products with clean hands. If you must touch your face, wash your hands first with soap and water. This simple act prevents transferring bacteria and oil. Pillowcases require special attention. You press your face against your pillowcase for 6 to 8 hours nightly. Throughout the week, it accumulates oil from your skin and hair, dead skin cells, product residue, dust, and bacteria. Sleeping on a dirty pillowcase reintroduces all of this to your skin night after night. Change your pillowcase at least twice weekly. If you're very acne prone, change it every night or flip it to the clean side and change daily. This simple habit can dramatically reduce breakouts. Choose soft, breathable fabrics. Silk or satin pillowcases are ideal. They're gentle on skin, don't absorb as much oil as cotton, and cause less friction. If silk is too expensive, soft cotton works fine as long as you change it frequently. Keep several pillowcases on hand so you always have clean ones available. Make changing your pillowcase part of your routine. Towels also matter. Your face towel accumulates bacteria with each use. Using a damp, bacteria-laden towel on freshly cleansed skin reintroduces problems. Use a clean towel for your face every time you wash it. Dedicate one small towel for your face only and wash it daily, or use disposable paper towels for drying your face, or air dry your face naturally. If you share towels with family, have your own designated face towel and wash it frequently. Your phone deserves attention. Think about how often your phone touches your face during calls and how many surfaces it contacts throughout the day. It's a breeding ground for bacteria. Then you press it against your cheek, transferring all that bacteria to your skin. Clean your phone daily with a disinfecting wipe safe for electronics. Focus on the screen and edges that touch your face. Use speakerphone or earbuds when possible to avoid direct face contact. If you must hold your phone to your face, clean it first. Hair hygiene affects your skin, especially along your hairline and forehead. Hair products, oils, pomades, gels, dry shampoo can migrate onto your skin, clogging pores and causing breakouts. Dirty hair carries oil and bacteria that transfer to your face. Wash your hair regularly based on your hair type and oil production. If you have oily hair, daily washing might be appropriate. Change your pillowcase after washing your hair, as wet hair can leave additional residue. Keep hair products away from your face. Apply them carefully, avoiding hairline and forehead. Pull hair back from your face, especially while sleeping. If you have bangs, wash them frequently or pin them back while your skin heals. If you use dry shampoo, be especially careful. The powder can settle on your face and clog pores. Apply it away from your face and brush your hair thoroughly afterward. Makeup brushes and sponges harbor bacteria if not cleaned regularly. Each time you use a dirty tool, you're applying bacteria along with your makeup. Clean makeup brushes weekly with gentle soap or brush cleaner. Wash sponges after each use or use disposable sponges. Replace brushes and sponges regularly. Every 3 to 6 months for brushes, more frequently for sponges. Between washings, spot clean brushes with brush cleaning spray if used daily. Store brushes and sponges in a clean, dry place where they can air out. Sheets and bedding extend beyond just pillowcases. Your face may contact your sheets, especially if you move during sleep. Wash all bedding weekly in hot water to kill bacteria and remove accumulated oils and dead skin cells. Consider using fragrance-free, gentle detergent if you have sensitive skin. Harsh detergents or fabric softeners can irritate skin and cause breakouts. Hats, scarves, and anything worn on your head or face should be cleaned regularly, especially if worn during exercise or in warm weather when sweat accumulates. These items contact your skin and can trap oil, sweat, and bacteria against it. Exercise equipment that touches your face, helmets, headbands, protective gear, should be cleaned after each use. Wipe down with disinfectant or wash if possible. At the gym, wipe down equipment before use if your face might touch it. Bring your own clean towel rather than using gym towels of unknown cleanliness. Glasses and sunglasses rest on your nose and near your skin. The nose pads and frames accumulate oil and bacteria. Clean them daily with gentle soap and water or lens cleaner. Pay attention to nose pads in areas that touch your skin. Hands must be clean when applying skincare products. Always wash your hands thoroughly before your skincare routine. This prevents introducing bacteria and dirt to your products and face. Avoid dipping fingers repeatedly into product jars, which can contaminate products with bacteria. Use clean spatulas or pumps when possible. If you must use fingers, wash them first each time. Keep your bathroom and skincare area clean. Wipe down counters regularly. Store products in a clean, dry area. Don't leave product caps off where they can collect dust and bacteria. Dental hygiene affects your mouth and chin area. Bacteria from your mouth can cause breakouts around your lips and chin. Brush teeth twice daily and floss regularly. Change your toothbrush every 3 to 4 months. These clean habits work together synergistically. Each one individually helps. Combined, they create a foundation for clearer skin. Make these habits automatic through consistency. Set reminders if needed until these practices become second nature. Within weeks, they'll be ingrained habits requiring no conscious thought. These habits are especially important during active breakouts, but maintain them always for prevention. Clean habits prevent new acne while you treat existing breakouts. Remember that hygiene is just one piece of acne prevention. Proper skincare, stress management, adequate sleep, balanced diet, and sometimes medical treatment are also important. But clean clean habits are within your control and cost nothing. As we close, embrace clean habits as acts of self-care that support clear skin. Simple hygiene practices, maintained consistently, prevent acne by reducing bacterial transfer and pore-clogging debris. May you develop clean habits effortlessly. May these simple practices support clear skin. May hygiene become automatic and easy. Thank you for this time together. Prevent acne through clean habits consistently.
Single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. a sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long-term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, 𝒆𝒐𝒗𝒊𝒏𝒈, Accutane, the definitive acne treatment for severe and resistant cases. 𝒆𝒐𝒗𝒊𝒏𝒈, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding 𝒆𝒐𝒗𝒊𝒏𝒈, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. 𝒆𝒐𝒗𝒊𝒏𝒈 is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes 𝒆𝒐𝒗𝒊𝒏𝒈 extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of 𝒆𝒐𝒗𝒊𝒏𝒈. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝒊𝒆𝒏𝒈 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning.
Hello, and welcome to this peaceful moment together. Let's begin with a gentle breath. Breathe in slowly, drawing in patience and understanding, and breathe out softly, releasing any urge to be harsh with yourself or your skin. Today we're going to explore how to reduce blackheads using gentle, effective methods that respect your skin's natural processes. Blackheads are one of the most common skin concerns and also one of the most misunderstood. Many people believe blackheads are dirt trapped in pores, which leads to aggressive scrubbing and harsh treatments. But blackheads aren't dirt. Understanding what they actually are is the first step toward treating them gently and effectively. A blackhead is a type of comedone, a clogged pore. It forms when a pore becomes filled with sebum, dead skin cells, and sometimes bacteria. The pore remains open at the surface, and when this mixture is exposed to air, it oxidizes and turns dark. That's why it looks black or dark gray. It's not dirt, it's oxidized oil and cellular debris. No amount of scrubbing will remove the oxidation or change this fundamental process. Blackheads form most commonly in areas with more active oil glands, typically the nose, chin, and forehead, collectively known as the T-zone. Some people are simply more prone to blackheads due to genetics, larger pore size, or more active sebum production. This isn't something you're doing wrong, it's just how your particular skin functions. Now let's talk about what doesn't work for blackheads. Despite being commonly recommended, harsh physical scrubs don't effectively clear blackheads. They might temporarily make your skin feel smoother, but they don't penetrate into pores to remove the blockage. They just irritate the surface and can damage your skin barrier. Pore strips feel satisfying when you peel them off and see the extracted material, but they only remove the very surface of the blackhead, not the deeper blockage. The blackhead returns quickly, often within days. Worse, pore strips can damage the delicate skin around your pores. Aggressive squeezing and extraction tools used at home often push bacteria deeper into the skin, enlarge pores, cause broken capillaries, and can lead to scarring. While professional extractions done by trained estheticians can be helpful, home extraction is usually more harmful than beneficial. So what actually works for blackheads? Let's explore gentle, effective methods that address the root cause rather than just the surface appearance. Chemical exfoliation is your most powerful tool for blackheads. Unlike physical scrubs that work only on the surface, chemical exfoliants penetrate into pores, dissolving the oil and dead skin cells that create blackheads. The most effective chemical exfoliant for blackheads is salicylic acid. Salicylic acid is a beta-hydroxy acid that's oil-soluble, meaning it can penetrate into oil-filled pores. It dissolves the connections between dead skin cells, allowing them to shed more easily. It also has mild antibacterial properties and reduces inflammation. For blackheads, salicylic acid is remarkably effective when used consistently. Start with a salicylic acid product in a 2% concentration. This could be a toner, serum, or cleanser, though leave-on products like toners and serums work better than cleansers because they have more contact time with your skin. Apply it once daily in the evening to areas prone to blackheads. After 2 weeks, if your skin tolerates it well and you're not seeing irritation, you can increase to twice daily, morning and evening. Be patient. Salicylic acid doesn't produce instant results. It takes consistent use over several weeks to see significant improvement. The blackheads you see today have been forming over time, and it takes time to dissolve them and prevent new ones. Expect to see noticeable improvement within 4 to 6 weeks of consistent use. Another effective ingredient is retinol or retinoids. These vitamin A derivatives speed up cell turnover, preventing dead skin cells from accumulating in pores. They also help normalize oil production and can minimize pore appearance over time. If you're using a retinoid for anti-aging or acne, it's also working to reduce your blackheads. Start with a low concentration. Use it gradually, perhaps 2 or 3 nights per week initially, and increase slowly as your skin adapts. Niacinamide is a gentler option that helps regulate oil production and can reduce pore appearance. While it won't dissolve existing blackheads like salicylic acid does, it helps prevent new ones by controlling sebum production. A serum with 5 to 10% niacinamide can be used daily and is well tolerated by most skin types. Clay masks, used once or twice weekly, can help manage blackheads by absorbing excess oil from pores. Choose a gentle clay like kaolin rather than harsh clays. Apply the mask only to your T-zone or areas with blackheads. You don't need to apply it to your entire face if you don't have blackheads everywhere. Leave it on for 10 to 15 minutes, then rinse gently with lukewarm water. Follow immediately with moisturizer to prevent dryness. Oil cleansing might sound counterintuitive for blackheads, but it's actually quite effective. The principle is that oil dissolves oil. A cleansing oil or balm can help soften and dissolve the sebum in blackheads, making them easier to remove. Use it as the first step in a double cleanse routine. Massage the cleansing oil onto dry skin for a full minute or two, paying special attention to areas with blackheads. The gentle massage helps loosen the blockages. Emulsify with water, rinse thoroughly, then follow with your regular cleanser. Consistent gentle cleansing is foundational. Use a mild, non-stripping cleanser twice daily. This removes surface oil and debris that could contribute to pore clogging. But remember, gentle is key. Harsh cleansing strips your skin, causing it to produce even more oil to compensate, which leads to more blackheads. Steam can temporarily soften blackheads and make them easier to address. Once or twice a week, you can hold your face over a bowl of hot water for 5 to 10 minutes, with a towel over your head to trap the steam. This opens pores slightly and softens the contents. After steaming, you can gently use a soft washcloth in circular motions over blackhead-prone areas, or apply a clay mask, or use your salicylic acid product. The steam enhances the effectiveness of whatever treatment follows, but don't steam more than twice weekly. Excessive heat can be irritating and damage capillaries. Proper moisturizing is crucial, even for blackhead-prone skin. When your skin is dehydrated, it often responds by producing more oil, which contributes to blackheads. Use a lightweight, non-comedogenic moisturizer after your treatments. This keeps your skin balanced and prevents the overproduction of oil that leads to clogged pores. Sunscreen is important too. If you're using salicylic acid or retinoids to treat blackheads, your skin is more sensitive to sun damage. Plus, sun protection prevents the post-inflammatory hyperpigmentation that can occur if blackheads become inflamed. Choose an oil-free, non-comedogenic sunscreen. Let's talk about realistic expectations. You cannot permanently eliminate blackheads. If you're prone to them due to your genetics and oil production, they will always tend to form. But you can manage them effectively, keeping them minimal and less noticeable. With consistent treatment, blackheads become smaller, less dark, and less numerous. This is success.
Đó, da em ốm mà. Em cho em ăn cũng nhiều lắm á.
As the day draws to a close, take a deep breath in
Mụn
and gently let
cộm hết tay luôn á.
Tonight we're going to explore how to build a simple, restorative nighttime skincare routine that honors your skin and prepares you for restful sleep.
Nóng hả?
Nighttime
À, lạnh
skincare
à.
routine is fundamentally different from morning. While mornings are about protection and preparation for the day ahead, evenings are about cleansing,
Này cũng sắp viêm đến nơi rồi đó.
and repair.
Không?
This is when you
Coi chưa?
remove
Nếu hôm qua sớm là viêm rồi.
throughout the day and give it the support it needs to regenerate while you sleep. There's something deeply satisfying about washing away the day. It's not just about removing makeup or sunscreen, though those are important. It's about releasing the stress, the environmental pollutants, the weight of all you've carried. Your nighttime skincare routine is a ritual of letting go, a bridge between the demands of your day and the peace of your rest. Let's begin with the most important evening step, cleansing. If you've worn makeup, sunscreen, or simply been out in the world, your skin needs thorough cleansing. This doesn't mean harsh scrubbing or aggressive products. It means gentle, effective removal of everything that's sitting on your skin's surface so that your skin
Con gái chị ạ.
can regenerate
Em bé
overnight.
gái.
Many people benefit from what's called double cleansing.
Em đẻ đứa em đẻ lần em tởn quá chị ơi.
Ở thường mới đẻ nói vậy.
Chưa có ý định nữa.
Chị nói từ đứa đầu của chị tới đứa thứ ba.
Dạ.
Tới hồi ông chồng nó
micellar water. These products are specifically designed to dissolve oil-based substances like sunscreen, makeup,
phải
and
ba
sebum.
đứa nó giống
They
như
work
kiền
on
ba
the
chân
principle
luôn.
that
Không biết
light
chắc hả?
like
Trời ơi,
oil
nuôi cũng
dissolves
chết luôn.
oil.
Mà ông có nuôi không hay là mình chị nuôi?
Dry
Ổng
skin,
nuôi, ổng lo rồi đưa đón này nọ, nhưng mà có điều là mình
allowing it to break down everything on your
lo
skin's
cái tuổi
surface.
trưởng thành á.
Then rinse with lukewarm water. You'll notice that
Tuổi nào cũng mệt chị, mỗi tuổi mệt theo kiểu.
this first cleanse often reveals just how much was sitting on your skin. Don't be alarmed. This is exactly what should happen. You're being thorough, not
Gái thì
obsessive.
nó đỡ.
The second cleanse uses your regular gentle
Gái đỡ lo hơn trai á
the
chị.
same type you might use in the morning.
Nói vậy thì cái nguyên những nhà mà con gái người ta lộn xộn á thì người ta lại phản đối cái đó.
Like sweat.
Còn
Apply it to your now
mình
damp skin.
trai nhà nhiều trai hơn cái là thấy mệt hơn gái.
If you haven't worn makeup or sunscreen, or if you have very dry skin, you might not need double cleansing. A single thorough cleanse with a gentle cleanser may be sufficient. Listen to your skin. If it feels clean but not tight after one cleanse, that's perfect.
Có bị
If
tăng
it
độ
still
chưa?
feels like there's a film on it,
Mắt em hả?
the double
Em lâu quá em chưa đo nữa chị.
as you cleanse,
Nhưng mà em phải dí sát để em mới thấy đường.
this isn't a
Bị
race.
cận là dí sáng.
Chứ còn mà em ngồi xa xa như mấy đứa nhân viên em là em không thấy đường.
Cleanser, the temperature of the water, the sensation
Với mắt em dễ bị chói á.
of
Cho
moving
nên
across
em phải
your
đeo mắt
skin.
kiếng này.
This is meditation in motion.
Nhưng mà em lấy mụn chuẩn.
It's a spiritual practice. Pat your face dry,
Nói là
clean towel.
con nào cũng ra
Now
bách phát
your
bách trúng á.
skin is ready for the restorative
Kinh nghiệm mấy
steps.
bao nhiêu năm rồi.
Immediately
Mười mấy năm rồi
after
chị.
while your skin is still slightly damp, you might apply a hydrating toner or essence. These products aren't mandatory, but many people find them soothing and beneficial in the evening. They add an extra layer of hydration and can help balance your skin's
Thật ra lấy mụn á, mà vừa lấy vừa quay như vậy nó khó hơn là
hands,
á,
gently
tại nó
pressing
bị hơi vướng tay á.
Em bị
This pressing
cái
motion,
ảnh hưởng
sometimes
tới
called patting in your products,
chị thấy
helps with
hướng mắt nữa
absorption
là
and
Yeah.
feels
Phải nương theo
wonderfully
nó.
calming. Take 3 deep breaths as you do this. Feel yourself settling
Giỏi quá
into
ta, cố gắng lên nha.
rest, into
nó
stillness.
chai rồi.
Now, welcome to
Chai hả?
detoxing sequence
Giỏ
if you
độ
use them.
chai.
Evening is the ideal
Ừ,
time
ông-
for
Là chú
active
sợ nhọn bây
ingredients.
giờ gãi nó
Your
đâu
skin
đến nó
is
con
in
chai
repair
khỏi
mode
giờ.
overnight,
Hmm.
and certain
Hoặc lát nó
ingredients
không
work most effectively
Còn
when
nó
your
đụng tới
skin
là
isn't
chảy
exposed to
nải.
sun.
Gái chị Tết này có về không chị?
Có
However,
Noel thì
let's
về.
be clear.
Dạ.
You
Có
don't
lại
need
ăn Tết
a
với chị không?
handful of
Nó
serums.
tính ở đó
You
mà.
might not
Nói
need
thôi
any serums at all.
về
A
trước
simple
Tết đi.
routine can be just as effective
Nó vẫn
as a
kiếm tiền.
complex one.
Ừ.
If you do use a treatment serum, apply
Giờ
it
đây
now.
kinh tế khó khăn.
This might be a vitamin C serum for brightening,
Tại bác còn
retinol
năm
for
học nữa.
anti-aging, a niacinamide serum for
Đi làm
overall
thêm hả chị?
Nó
or
đi
any
làm
other
nail á.
targeted treatment.
À,
Use only what your skin needs and can tolerate.
làm nail là phải có học bằng mới làm đúng không chị?
Nó có mình về
Apply serums
phải
to
làm
damp
chuyên nghiệp.
skin
Mình
using gentle
Làm phụ
pressing
đúng không?
phụ
motions.
thôi.
A little goes a long way with most serums.
Nhưng mà lương
A
cũng
pea-sized amount
Ừ.
or a few drops
Em thấy
is
bển làm nail thu nhập tốt nè.
face. Don't
nó là
forget
thợ
your neck.
phụ thì nó
It ages
210
just
đô
like your face
ngày.
and deserves the
Thợ
same
chính là
attention.
300 đô.
If you're using any
Mhm.
active ingredients like retinol or acids, remember to introduce them slowly. Start with once or twice a week and gradually increase frequency as your skin builds tolerance. And please, be patient. These ingredients work over months, not days. Consistency matters more than intensity. After your serums have absorbed for a minute or two, it's time for your evening moisturizer. Your nighttime moisturizer can be richer and more nourishing than your morning one. You don't need to worry about it sitting under makeup or sunscreen, so you can choose something more emollient, something that deeply hydrates and supports your skin's overnight repair processes. Apply your moisturizer generously. Use upward-outward motions as you smooth it across your face and neck. Take your time. Massage it in gently, feeling any tension in your facial muscles release under your fingertips. This is your time to be fully present with yourself. Some people like to add a facial oil as a final step, especially if they have very dry skin or live in a dry climate. Facial oils act as an occlusive layer, sealing in all the hydration you've just applied. Just a few drops warmed between your palms and pressed gently onto your face can make a significant difference in how your skin feels in the morning. Don't forget about your eye area. The skin around your eyes is thinner and more delicate than the rest of your face. An eye cream isn't absolutely necessary. Your regular
Lấy hai cái góc nó mới ra hết.
work for this area
Hơi
too.
cứng nè.
But if you choose to use one, apply it now.
Nãy giờ mới có con chỏm như đây. Mới có chỏm gì đó tại ở nhà.
Gentlest pressure and tap the product around your orbital
Chưa có
bone.
được
Never pull
một cái bên má luôn á.
this delicate skin. And here's a special touch. Consider your lips part of your nighttime skincare routine. Apply a nourishing lip balm or treatment before bed. Your lips have no oil glands and can become very dry, especially overnight. A little attention here goes a long way. Let's pause and review your evening routine. Thorough cleansing, hydrating toner if desired, treatment serums if needed, rich moisturizer, and optional facial oil. These steps support your skin's natural nighttime repair processes. But as with your morning routine, your evening skincare exists within a larger context of nighttime habits that affect your skin's health. The timing of your routine matters. Ideally, complete your skincare routine at least 30 minutes before bed. This gives products time to absorb fully and prevents them from rubbing off onto your pillowcase. It also creates a clear ritual that signals to your
Dạ
body
không.
the day is done, rest is coming. Your bedroom
Không phải sữa
environment impacts your skin
mà
overnight.
sữa mấy cái máy á
If you
chị.
sleep in a very warm room or use heavy blankets, you might sweat more, which can affect oil production and potentially clog pores. If possible, keep your bedroom cool and comfortable. Similarly, if your bedroom is very dry, especially in winter, consider using a humidifier. The moisture in the air helps prevent your skin from becoming dehydrated as you sleep. Your pillowcase is your skin's companion for 6 to 8 hours every night. Make sure it's clean. Change it at least twice a week, more often if you're acne prone. Silk or satin pillowcases are gentler on your skin than cotton and can help reduce friction and pressure marks. This is a small change that can make a noticeable difference. Try to sleep on your back if possible. Sleeping on your side or stomach means your face is pressed against your pillow for hours, which can create sleep lines over time and potentially transfer oils and bacteria back onto your skin. If you can't sleep on your back, don't stress about it. Sleep quality matters more than sleep position. Just be aware and perhaps invest in a silk pillowcase. Your evening routine should also include not touching your face unnecessarily. Throughout the day, your hands accumulate bacteria, oil, and environmental pollutants. Touching your face transfers all of this
Đó,
onto
được
your
một
skin.
má rồi nha.
After you've completed your night Welcome to this understanding, compassionate space. Breathe deeply and know you're not alone. Today we're talking about hormonal acne, those frustrating breakouts that seem to appear on a schedule, often resistant to typical treatments. Let's explore how to manage hormonal acne gently and effectively. Hormonal acne is deeply connected to your body's internal rhythms and cycles. It typically appears along your jawline, chin, and lower cheeks, though it can occur anywhere. For many people, it flares predictably before menstruation, during ovulation, during pregnancy, or during other hormonal shifts. Understanding this connection helps you approach it with patience rather than frustration. Hormones, particularly androgens like testosterone, influence sebum production. When these hormones fluctuate or increase, your oil glands produce more sebum, leading to clogged pores and breakouts. This is why hormonal acne often begins or worsens during puberty, pregnancy, menstrual cycles, perimenopause, or when starting or stopping hormonal birth control. The gentle approach to hormonal acne combines appropriate topical care with lifestyle support and, when necessary, internal treatments. Because hormonal acne is driven by internal factors, topical treatments alone often aren't sufficient, but they're still an important part of management. For topical care, establish a gentle routine with proven acne-fighting ingredients. Cleanse once daily with a gentle cleanser, preferably one containing salicylic acid to help keep pores clear. In the morning, rinse with water or use a very light cleanse. Use topical retinoids, which are particularly effective for hormonal acne. Over-the-counter adapalene or prescription tretinoin increase cell turnover, preventing pores from clogging and reducing inflammation. Start with 2 to 3 applications per week and gradually increase as tolerated. Always use sunscreen the next day. Benzoyl peroxide spot treatments can help with active breakouts by killing bacteria and reducing inflammation. Use 2.5% concentration to minimize irritation. Niacinamide is beautifully supportive for hormonal acne. It helps regulate oil production, reduces inflammation, and supports barrier function. A serum or moisturizer with 5% niacinamide can be used twice daily. Azelaic acid addresses both active acne and post-inflammatory marks. It's gentle enough for daily use and works well for hormonal patterns. Always moisturize, even with oily, acne-prone skin. Use lightweight, non-comedogenic formulas. Well-hydrated skin with a healthy barrier responds better to treatment. Sun protection is essential, especially when using retinoids or other sensitizing treatments. Choose oil-free, non-comedogenic sunscreen. Now let's discuss internal approaches to hormonal acne. Since hormonal acne is driven by internal hormone fluctuations, addressing the internal aspect is often necessary for significant improvement. For those who menstruate, certain oral contraceptives can help regulate hormones and reduce acne. Pills containing estrogen and specific progestins, like drospirenone, are FDA approved for acne treatment. Discuss this option with your healthcare provider if it's appropriate for you. Spironolactone is a medication that blocks androgen receptors, reducing the hormonal trigger for acne. It's particularly effective for adult women with hormonal acne. Discuss with a dermatologist whether this might be appropriate for you. It requires monitoring and isn't suitable for everyone, but for many people, it's genuinely life-changing. For severe hormonal acne not responding to other treatments, 𝒌𝒊𝒏𝒈, Accutane, may be considered. This powerful medication requires careful monitoring and has significant side effects, but it can provide lasting improvement for severe cases. Lifestyle factors significantly influence hormonal balance and thus hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques daily. Meditation, deep breathing, yoga, time in nature, creative expression, or whatever genuinely calms you. Sleep adequately. Sleep deprivation disrupts hormonal balance and increases stress hormones. Aim for 7-9 hours nightly with consistent sleep times. Exercise regularly but not excessively. Moderate exercise helps regulate hormones and reduce stress. However, excessive intense exercise can actually worsen hormonal imbalance in some people. Eat a balanced anti-inflammatory diet. Some research suggests that high glycemic foods and dairy may worsen hormonal acne for some people. Consider trying a lower glycemic diet or eliminating dairy for 6 to 8 weeks to see if it helps. Include foods that support hormone balance, omega-3 rich fish, fiber for helping eliminate excess hormones, antioxidant-rich vegetables and fruits, and adequate protein. Stay well hydrated. Water supports all bodily functions, including hormone regulation and skin health. Consider supplements that may support hormonal balance, though always consult a healthcare provider first. Some people find benefit from omega-3 fatty acids, zinc, evening primrose oil, or DEEM, dendolylmethane. However, supplements aren't regulated as strictly as medications, and effectiveness varies. Track your cycle and your breakouts. If you menstruate, note when in your cycle breakouts occur. This pattern helps you understand your hormonal acne and can guide treatment timing. Some people intensify topical treatments during their high breakout phase of their cycle. Be especially gentle during hormonal flare periods. Your skin is more reactive and sensitive during these times. Avoid introducing new products or harsh treatments right before or during your period. Limit dairy consumption. While the connection isn't proven for everyone, many people find their hormonal acne improves when they reduce or eliminate dairy, particularly milk. The hormones naturally present in dairy may contribute to breakouts in susceptible individuals. Avoid touching your face, which transfers bacteria and oil. This is especially important during hormonal breakout periods when your skin is more vulnerable. Keep everything that touches your face clean: pillowcases, phone, makeup brushes. Change pillowcases every 2 to 3 days during active breakouts. Don't pick at hormonal acne. Deep hormonal breakouts are particularly prone to scarring when picked. Keep your hands away no matter how tempting. Be patient with treatment. Hormonal acne often takes longer to respond to treatment than other types. Expect 3 to 6 months before seeing significant improvement. Hormonal treatments in particular take time to regulate hormone levels and show effects on your skin. Understand that hormonal acne may not be completely curable, but it's highly manageable. Even with good treatment, you may have some breakouts during hormonal fluctuations. The goal is significant improvement, not perfection. For severe or persistent hormonal acne, work with a dermatologist. They can prescribe stronger topical treatments, recommend hormonal therapies, or discuss systemic options. Professional guidance is valuable for stubborn hormonal acne. Remember that hormonal acne is not your fault. It's not caused by poor hygiene or inadequate skincare. It's your body responding to internal hormonal signals. Treat yourself with compassion, not judgment. As we close, remember, hormonal acne requires patience, comprehensive care addressing both external and internal factors, and self-compassion. With appropriate treatment and lifestyle support, significant improvement is possible. May your hormones find balance. May your skin clear.
Same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. Starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7. Hormonal acne in women, causes, recognition, and comprehensive medical management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularity,